I've been looking at a lot of X-rays this week, and it got me to wondering, do you know why we take X-rays? I'm Dr. Scheurer from Tranquil Dental. The main reason why we take X-rays, there's a few reasons, but the main reason we take X-rays is to allow us to see things we can't see visually by just looking with our eyes. Certainly, sometimes it affords us the opportunity to also have a time lapse to see how things might have changed over time. But the main reason is to be able to see things that we can't see with our eyes. So I gathered some X-rays because I thought they might show a really good example of a lot of the different ways that we can use them and different things that we can see by using X-rays. So the first X-ray here you can see is actually one of the main reasons that we use the X-rays, and that's to be able to see decay that's in between teeth. So when you have two teeth that are coming up against one another, if you have decay in between the two teeth, that's a place that's really not accessible to us. So the X-ray shoots a picture through there and allows you to be able to see that image. So in this example, you can see that the decay is right here. So the bright white is the enamel on the tooth, and then you can see how the decay actually eats into the enamel so that you have a dark shadow going in through that enamel. So there's a lack of enamel right there. So that's decay that's in between the teeth. Another way that we can see it is if the decay gets up underneath a crown. So sometimes if you have a crown on your tooth, it's up at the gum line. And so the tooth can still get decay up underneath there, but it can be really hard to see that or even sometimes to feel that, depending upon where the edge of the crown is. But in this example, you can see the dark shadowy area right there that is underneath the crown. So this is actually a bridge. So that's a crown on the tooth, and that post right there is actually a post from where a tooth has had a root canal. But that dark shadowy area on the back side there, that's the decay. So we're able to see the decay on natural teeth and how it goes into enamel, but we can also see them on teeth, for example, that have crowns that are all the way up at the gum line and you can't see it or feel it very well. Another thing that we can see is how deep or how far does the decay go. And so in this example, you can see that there's decay here on the back side of this tooth. And you can kind of see a dark shadowy area that comes in this direction. Well, this dark line, this dark area in the middle of the tooth, is actually the nerve of the tooth. So the X-ray affords you the ability to look inside to see how far does that decay go, or how close to the nerve of the tooth is that decay. Something else it allows us to see is bone loss. When you're looking at teeth and gum tissue, you can't literally see where the bone is. And so when there's bone loss, sometimes we can see that through measurements that we take, but really to be able to see where the bone is in relation to the tooth, you need that X-ray. So for example, on this tooth, you can see there's a lot of bone loss on the back side of this tooth. So this is the top part of the tooth. You have the root here. And then this right here in between the roots of the tooth, that's bone. And the bone right now, the top of the bone is right here. But the bone used to be all the way up here at one time. So that's a lot of bone loss on the back side of that tooth. And you don't ever get to see bone by looking, well, I guess sometimes you can see bone, but if there's like a surgery or something like that. But generally speaking, if you're just looking in the mouth, you're not seeing the bone. The gums are covering it up, and so you can't see that position. So the X-rays allow us to see that. This X-ray allows us to see a couple of things. One is you can see right back here, and what's hiding there underneath the gums and underneath the bone is a wisdom tooth. It's a wisdom tooth that's down a little bit lower, and it's tilted forward towards that tooth. So if you were to look inside the patient's mouth, you would only see gum tissue there past the last tooth, and it's way far back there. But with the x-ray, you can see that indeed that person has a wisdom tooth back there, the very last tooth back there. On the back side of the last tooth that's in the patient's mouth, so if you're brushing or looking at the teeth, the very last tooth back there, one of the things you're able to see here on the x-ray is a couple of areas of calculus right here and here. And we've talked about calculus before, or tartar. And so this can be a very difficult place to see because it's on the very back side of the very last tooth back there. But you can see it kind of sort of looks like a little spur or a little barnacle hanging off the back side of that tooth. This x-ray allows us to see two things. One of the wonderful things that x-rays really allows us to see is when a patient has an infection. And so sometimes a patient can have an infection with a tooth that causes a lot of swelling or a lot of discomfort, and then we know that there's a problem. But sometimes there can actually be an infection without any swelling or without any discomfort. And what it does is it actually kind of dissolves the bone at the tip of the root. And so that can be considered an abscess. And when you see on an x-ray a dark shadowy area right there, you know that that's an abscess, an infection. So it could afford us in dentistry the ability to be able to say to a patient, I can see that, and that's an abscess. And so if you want to take care of that, we need to have a root canal in order to get rid of that infection. And we can do that before it causes you a lot of discomfort or swelling in that area. So an x-ray allows us to see that because that's up in the bone. And this is our last x-ray, and this is another one of the reasons why it's so important for us to be able to take those x-rays. There's a lot of reasons why it's important for us to take x-rays and all the things that we can see when we take them. And I can't go over all of them, but I've gone over a number of them. The ability to see a wisdom tooth that might be underneath the gum tissue, the ability to see calculus, the ability to see decay on a tooth, how deep that decay may go and how close to the nerve of the tooth it is, the ability to see decay up underneath a crown edge that might be at the gum line and you can't see it there, the ability to see an abscess that's up at the tip of the root of the tooth. And there's lots of other reasons. There are other things that we can see and reasons why we take the x-rays. But the last one I wanted to go over with you is something called resorption. And resorption is this natural phenomenon. It doesn't happen a lot, but it does happen sometimes. And it's this strange situation where the tooth kind of sort of starts to eat itself. And so it's not a decay, but it is a loss of tooth structure. And a lot of times that's down on the root surface. So it's like at the area of the bone. And so you can't see that. Sometimes it's from the inside out, sometimes it's from the outside in. But when you have an x-ray, you can see. So in this instance, it's this dark area right there, that strange kind of circle in the middle there. And unfortunately, this patient actually lost that tooth because of that resorption that exists there. But we were able to make sure that we could see it and we could address it before it became an issue where he had infection or a lot of bone loss in that area. So I hope that this gave you a little bit more insight into why it's so important for us to take x-rays.